So our reason for being is making talking therapy accessible to all young people in the community from different backgrounds and different places who need it.
Open Door was a place I could go when I felt like I couldn't rely on other sources of guidance in my life.
And we do manage to engage young people that often experience barriers to other services, and we try to have as few exclusion criteria as possible so that all a young person has to just pick up the phone and say, I want help. We're also working alongside the Tottenham Hotspur's Foundation and Deep Black.
We might use a range of creative techniques. It could be anything from painting, drawing, drama, music, photography, as ways for a group to connect with each other and to express what's going on for them at a deeper level.
I work for Tottenham Hotspur Foundation. We are part of the Inequalities and Diversity Fund. We work to deliver positive outcomes for secondary schools within the local area.
So working with the groups that have struggled with the transition from primary school. So they're playing football with the coaches and me as a therapist working alongside them and thinking together about what comes up in that space, like winning and losing, working with frustrations, shame, also a chance to have one-to-one conversations with them a lot more informally than in the therapy room.
And that's an opportunity for some young people who may not even kind of want to engage with us to have an experience of doing something they love and working with a therapist as well.
The numbers of young people that we've worked with and the positive outcomes from that have been phenomenal.
The idea of the project was both introducing basic photography tools and techniques and to help students express what was going on for them.
I was able to understand it more and see why a person acted the way they acted, and it also helped me to see why maybe I was acting the way I was acting, and I'm able to use that in my everyday school life and home life as well.
We know that health inequality is not just physical health inequality, it is also mental health inequality.
She just understood everything that went wrong in my life. I blame myself, and the first time she told me, it's not your fault, I did burst into tears.
To have high numbers of children and young people actually coming and engaging in a therapeutic football group or coming to a service and talking about what's going on for them inside and in their external lives is already helping to make a difference.
It's your space to whatever you want, and the other individual allows you to just be yourself.
And the group of young people that came had really quite high levels of mental health need.
When you're seeking for help, you're already in such a dark place. You really need help as soon as you can.
There are still other young people that, even with us, may not want to talk, and thinking about what other opportunities are there out there to reach some of these kids.
Before therapy, I really didn't understand why I was feeling a certain way. Open Door really helped unpack that.
Helps me a lot with my emotional well-being. Sometimes I have a lot of mixed emotions, but now I can figure out which one I'm feeling at the time.
By the end of their therapy and engagement, that these mental health difficulties had come down significantly for many of them. And the amount that say, what was really good about your care, I was listening to.